Okay, now it's 5 p.m. in the evening. I'm on the side of the road, which is busy road. Let's see how much sound pressure level is straight. So we can see that right now it's 72 dB SPL. Very steady. It's about 72 dB SPL. It's I would say noisy, not really extremely high noisy, but noisy street. This is again 5 p.m. in the evening on a busy road. Okay. So we are going to go inside. And do another measurement in the parking lot in front of the hotel. This is about 20 feet away from the road. Now let's see. It's a lot better. It's a 54 dB SPL, which is significantly lower. It's about 28 dB lower than the street. Okay, so you can see that even 20 feet away, we have a lot more quiet environment in the parking area of the hotel here. Pretty significant difference, right? So just a little bit away from noisy environment. So that means we don't want to stay too close to the street. It's very noisy. It's a little bit disturbing too. So that's not good for our brain and our hearing system. So we want to stay in a quiet environment. Even it's not damaging. We mentioned in previous videos that 85 dB SPL threshold of being dangerous, right? So 72 dB SPL is not exceeding 85 threshold. The 85 dB SPL is regulated by U.S. Department of Labor. Okay, so if you're interested, you can take a look at the previous videos. Today, what we are going to talk about is a disease related to hearing. So we mentioned in a previous video about the symptoms of acoustic neuroma. So we also talk about hearing test, CT and MRI for diagnosis of this particular acoustic tumor. Today we will introduce 3 treatment options for acoustic neuroma. For treatment, the 3 options are: first option is surgery to remove the tumor. This is a highly effective treatment. Hearing loss that has already occurred from tumor unfortunately cannot be reversed, but the remaining hearing can be preserved in some cases. Surgical removal can often address balance issues, facial numbness, and other symptoms. Second option is stereotactic radiosurgery. This radiation therapy delivers precisely target radiation to the tumor, at the same time avoiding the surrounding healthy tissues. Radiation does not cause the tumor to go away. Rather, the goal is to stop or slow down the growth. Typically, radiation therapy is not recommended for young patients. Or those with larger tumors. Last option is observation. This means waiting and watching it can be an option for some patients, particularly because neuromas are usually slowly growing. Immediate intervention is not always necessary. For some patients with very small tumors, no symptom, some senior patients, or some patients with serious medical conditions, the doctor may recommend regular monitoring of the tumor by MRI. So what are three key goals for treatment? The three key goals are: number one, preserving facial nerve function; number two, optimizing hearing outcomes; and number three, maintain higher quality of life. Let us focus on the first option of surgical removal. The first goal of surgery is to remove the tumor while preserving the facial nerve function. Second goal is the hearing preservation. But hearing preservation depends on two factors. Number one, how well you hear before the surgery. Number two, how big the tumor is. Roughly half of patients with the smallest tumors who have useful hearing before surgery will maintain useful hearing after surgery. Hearing preservation is less likely for larger tumors. Risk of hearing and facial nerve complication after surgery increases the size of tumor. Monitoring of brain and nerve function is a critical part during the process of surgery. A team of neurologists and electrophysiologists watches for any changes in facial and hearing nerve activities, as well as for changes in the brain. Being aware of such changes can help the surgeon avoid neurological complication during the process of surgery. Next, let's introduce second treatment option, radiosurgery. Radiosurgery is also called stereotactic radiosurgery. It is a non-invasive procedure that uses precisely focused narrow beams of radiation to treat the tumor, while limiting the amount of radiation that affects the hearing, balance, and the facial nerves. This therapy can reduce the growth of a tumor. Doctors may recommend radiosurgery for senior patients who might be too fragile to endure more invasive treatment. Radiosurgery may also be used in combination with surgery for large tumors that cannot be removed completely without permanently damaging the facial nerve or other structures. A typical question is, what if acoustic neuroma returns after radiosurgery? The answer is, radiation treatment requires ongoing follow-up and annual MRI scan to watch for tumor regrowth. This is because parts of the tumor unaffected by radiation may have new growth. Signs of acoustic neuroma coming back could include facial muscle weakness and spasm that slowly worsen. If the tumor comes back, repeated radiation is usually unsafe, and doctor may recommend surgery. Acoustic neuroma surgery after radiotherapy treatment can be complicated by scar tissues, because scar tissues make difficult to separate the tumor from adjacent nerves. Last treatment option is observation. Acoustic neuromas are non-cancerous tumors, so they can often be closely monitored without treatment, unless the tumor is already very large or is causing significant symptoms. Doctor may recommend getting a follow-up MRI after 6 to 12 months. Natural question is, which treatment option is best for me? Three factors are tumor size, severity of symptoms, and tumor growth rate. The three factors decide which treatment option is the best for me. First factor is size. The tumor looks like ice cream cones, so the measurement varies depending on whether the tumor is measured vertically or horizontally. Diameter of the ice cream on top, that is part of the tumor that pushes into the brainstem, and the cerebellum is what matters, and it should determine the treatment. If a brain tumor is larger than 20 to 25 millimeters at time of diagnosis, your doctor may consider treatment even if your symptoms aren't worrisome. Second factor is severe or worsening symptoms. Sometimes a larger acoustic neuroma can cause only minor symptoms, but sometimes a small tumor can be incapacitating. Severe facial pain, balance issues, and falls can affect quality of life, and straightforwardly treating the tumor might be the best option. If you have been diagnosed with acoustic neuroma and you notice that symptoms such as imbalance, facial numbness, weakness, or hearing loss are becoming worse, contact your doctor. These worsening symptoms may be a good reason to move from watching to action. The third factor is how fast the tumor grows. If the doctor is monitoring acoustic neuroma and repeated MRI exams show that the tumor is growing, it might be the time for treatment. Depending on the rate of growth, the tumor's shape, size, and location, as well as the overall health. Okay, I have finished the treatment. What are the potential post-operative complications? After treatment, some patients experience hearing loss, damage to facial nerves, cerebral spinal fluid leak, and other problems. First, a complication is hearing loss. For ongoing hearing loss after acoustic neuroma surgery, a doctor may recommend a hearing device for me. For example, a bone-anchored hearing aid, an over-the-air regular hearing aid, a cochlear implant, or a brainstem implant. If this is the case, which device will be chosen for me? If I have a genetic disorder of neurofibromatosis type 2, NF2, I can develop acoustic neuromas in both ears, hearing deafness in both ears. This is bilateral deafness. In this scenario, a cochlear implant or auditory brainstem implant can help provide a sense of sound and possibly help me understand speech. Cochlear implants are more expensive than hearing aids. The average cost of cochlear implants can range from $30,000 to $50,000 without insurance. Fortunately, for bilateral deafness, most major insurance agencies and federal insurance programs provide coverage for cochlear implants. The second complication is facial nerve damage. Facial nerve damage is sometimes only temporary and can recover in several months or years. If the damage is permanent, a facial plastic surgeon can perform nerve transfer surgery or other procedure to help me restore movement in the face. The last complication is cerebral spinal fluid leaks. Cerebral spinal fluid leaks are caused by a hole or tear in a membrane that covers the brain and the spinal cord. If a leak occurs, a doctor can perform a procedure to block the hole that is leaking cerebral spinal fluid. This is Mr. Harris. Today we introduce 3 treatment options for acoustic neuromas. Number 1, a surgical removal. Number 2, a stereotactic radio surgery. Number 3, observation. We also talk about the criteria to choose which option is the best for me. Lastly, we list the 3 post-operative complications: hearing loss, damage to facial nerves, and cerebral spinal fluid leaks. We also introduce how doctors handle those complications. I strongly advocate preventive care for hearing health. I wish you a very healthy hearing. If you are being treated, I wish you a speedy recovery and have a very happy life. If you like the video, feel free to like or subscribe. Your support is motivating me a lot. Thank you very much. See you in next video. Bye bye.